So prolapse is, well, when we talk about vaginal prolapse, we're talking about the walls of the vagina and the fact that they can come down. So in the vagina, you've got the front wall, and behind that is the bladder. And so the bladder can come down into the vagina. And then at the top is usually the uterus or the womb, or if someone's had a hysterectomy, then there's just skin at the top that we call the vault, but that can come down into the vagina as well. And then we've also got the back wall of the vagina. And behind there is a lower part of the bowel called the rectum, and that can come forward. So prolapse is where the walls of the vagina essentially collapse or come down. And the patient will usually feel the symptom of a lump or a bulge or a heavy feeling. And I suppose an important thing to say about prolapse is if you had an examination and someone said there's prolapse, but you don't feel this sensation of a lump or a bulge or a heavy feeling, or sometimes there can be impacts on how the bladder and bowel behave, then it's not necessarily a problem. So the causes of prolapse really are anything that puts extra pressure on our pelvic floor. So the pelvic floor is like a sling of muscles that supports everything inside our abdomen. So the main culprits for that is pregnancy, so carrying a baby around for 9 months or sometimes two babies or multiple pregnancies, and then vaginal childbirth. So when the baby comes through the birth canal, muscles can be stretched, they can be torn. While we're young, often those muscles will sort of make up for the damage. But then when we come to the menopause and a perimenopausal, we have less of the hormone estrogen, those muscles can struggle to contain the organs, and then we're more likely to have prolapse. It can happen in women who haven't been pregnant or haven't had vaginal delivery, but it's 8 times more common in a woman who's had 2 vaginal childbirths. So with prolapse, women will often feel a sort of a lump or a bulge, or we sometimes describe it as a sensation of something coming down. Um, with the womb in particular, if that's coming down, women might notice a heavy dragging feeling in their pelvis. Some of the clues is that it can be worse towards the end of the day. So my patients will tell me when they wake up in the morning, they feel fine, but then when they've been on their feet at the end of a long, busy day, they'll tend to get this dragging, heavy feeling. It often comes on gradually over a number of years, in fact, rather than suddenly, although there can be a moment when it sort of swaps from a mild feeling to more of an obvious feeling, and a woman might then come to see me about her prolapse. So, diagnosis and assessment is a lot to do with taking a history. So, the conversation between me and the patient, understanding what symptoms there are and whether or not that could fit with prolapse. And then, obviously, examination is important to see is there something there that could correspond. Interestingly, someone might have very severe symptoms, and then on examination, the amount of prolapse or the amount the walls of the vagina are coming down could be mild. I always take time to do a really thorough examination. So rather than just have my patient lie on her back, I'll often ask her to lie on her side. And sometimes we'll even get the patient to stand up and unexamine from below to try and really understand what's happening with the pelvic floor. So when it comes to the treatment of prolapse, there's actually lots that can be done that isn't operations. So the kind of end of the line is surgery and operations, but actually we try and do everything we can to avoid that unless absolutely necessary. So pelvic floor exercises, and I supervised pelvic floor exercises, so with a physiotherapist feeding back to the patient, have been shown to make a huge difference in prolapse. So they can stop prolapse from progressing, or they can even help it to get better. Changes in sort of lifestyle can make a difference as well. There are also treatments such as a pessary. And so that's usually a plastic or silicone ring, although there are other shapes, that sits inside the vagina and can lift and support the prolapse. They tend to be changed every 4 to 6 months. They take away the symptoms of the prolapse. The prolapse would still be there when the pessary is taken out. But for lots of women who are not in a place to have an operation, it's a really great option. And other women who actually just prefer it to the idea of having surgery. So a huge range of things that can be done. So yes, I think prevention of prolapse is very amenable to sort of lifestyle changes. So through our life course, thinking about those things that put extra pressure on the pelvic floor. So obviously pregnancy and childbirth, for most women, that's going to happen. But otherwise, if you're chronically constipated, that's going to put a lot of pressure on the pelvic floor. If you're straining, that's going to increase your risk of prolapse. Weight, any additional weight that goes through our pelvic floor is going to put extra tension on those muscles. Um, Physical activity or sports, I mean, I encourage sports, and keeping a healthy core is really important. So our pelvic floor muscles are linked to our abdominal muscles and our lower back muscles as well. So exercise really is important to keep healthy, but doing it in a sort of sensible way. So making sure that if we're doing strength training, which is important as we get older as women, but making sure we're really engaging our pelvic floor so that we're not causing prolapse or worsening prolapse. And as I mentioned about the physiotherapy, that can actually improve prolapse. I think lots of women might be skeptical about that, because where they've talked about pelvic floor before, someone just gives them a leaflet and sends them away. And we know that actually that's not good enough. And many women, when they're just told to do their pelvic floor exercises, they're not actually doing them correctly. It's pretty tricky to get it right. And it's really important to see someone who can help you to do that properly.